In this presentation, we're going to talk about the cannabis. But first of all, we're going to talk about the history of the cannabis. Cannabis was first used in the Western China, the Central Asia, and the thousands of the years. And the people have utilized cannabis for the medical benefits. And it was also used for the first time in the writing about 2800 BC. So it has a long history. It has been used by different.
Now we are going to talk about the pharmacokinetics. So here we go with pharmacokinetics. First of all, we will talk about after being ingested orally, tetrahydrocannabinoids move to the liver where the minority of it is removed and metabolized. CPY2C and CPY3A in the liver content convert tetrahydrocannabinoid into other chemicals. If we see cannabis is basically taken by two ways. First one is orally, and second one is by inhalation. If we take it orally, it will metabolize by the liver, and then it will excrete out through urine and feces. If we take it by inhalation, then it will directly add to our systemic circulation, and it will excrete out through urine. So these are the basic pharmacokinetics of the cannabis.
Now we're going to talk about the receptors where cannabis usually bind. So there are multiple receptors. For example, CB1 receptor, CB2, GPR18, GPR55. CB1 receptors, they are concentrated in the brain, central nervous system, and also present in some nerves and organs. While the CB2 receptors, they are mostly in the peripheral organs, especially cells associated with the immune system. And the third one is the GPR18 receptors that are primarily present in the bone marrow, the spleen, the lymph nodes, and to a lesser extent in the testes it is also present. But at the end, GPR55, these receptors are found in the bones, the brains, particularly like in the cerebellum and the genome. So these are the receptors of cannabis. So now we're going to talk about the toxicity. The toxicity of the cannabis can cause impaired motor skill, donations, slugness, convulsiveness. Seizures and sedations, they are actually rare, and severe psychosis can be occur in the patient with a sensitive, and agitation can also cause. So now how can we treat the toxicity? The toxicity can be treated with by seeking the medical attentions and subside over time as the body metabolizes the compound. And benzodiazepine or antipsychotics under medical supervision, like piprazole, we can use in this condition. Then evaluation and monitoring and supportive cares. So now we're going to talk about the dose of the cannabis. Administration route is basically if we inhale, then it is around about from 11 to 45% that goes through the lung, and if we take oral, then it's 6%. And the clinical uses of the cannabis are the chronic pain management, nausea, vomiting, neurological disorders, mental health conditions, palliative care, inflammation, bowel disease, and sometimes it is used in the epilepsy. It is used in the secondary. Like we're not saying that the cannabis will heal all the epileptic disorders. It reduces the symptoms, like it boosts the immunity in AIDS, in epilepsy. It causes the sedations and all this stuff. Now we're going to talk about the dose of the cannabis. The dose is basically standard. The unit is 5 mg. It should not exceed 40 mg per day. If we take the exceed amount of the cannabis, it will cause drastic effects. So this was all the cannabinoids, and thank you very much for listening.